What is a heart attack? A heart attack, medically known as a myocardial infarction, occurs when the blood flow to a part of the heart muscle becomes blocked. The heart muscle, like any muscle in the body, needs a constant supply of oxygen-rich blood to function properly. This blood is delivered through the coronary arteries. When one or more of these arteries become blocked or narrowed, the flow of blood is compromised, which can lead to damage or death of the heart muscle. Think of the heart as a pump, circulating blood to vital organs and tissues. The coronary arteries act as the lifelines to the heart itself, ensuring it receives the oxygen and nutrients it needs. But if these arteries become obstructed, the heart struggles to perform its job effectively. Causes of heart attacks. The most common cause of a heart attack is atherosclerosis, a condition in which fatty deposits, called plaque, build up inside the coronary arteries. These plaques are made of cholesterol, fat, and other substances found in the blood. Over time, they thicken the walls of the arteries, making them narrower and more rigid. If the plaque ruptures or breaks open, a blood clot forms around the rupture, which can block the artery completely. This blockage prevents blood from reaching part of the heart muscle, leading to a heart attack. Other causes of heart attacks include spasm of the coronary artery, a temporary narrowing of the artery due to stress, drugs, or other factors, which can also reduce blood flow, tear in the artery wall. Sometimes the wall of the artery tears, leading to blood clots and blockage. Severe physical exertion or stress. In rare cases, intense physical strain or stress can cause a heart attack, particularly in individuals with underlying coronary artery disease. Risk factors that increase the likelihood of a heart attack include high blood pressure, high cholesterol, smoking, diabetes, lack of physical activity, obesity, family history of heart disease, and excessive alcohol consumption. How a heart attack happens. Here's a closer look at the process of a heart attack, the plaque buildup. Over the years, a buildup of cholesterol and fat accumulates inside the coronary arteries. This plaque narrows the artery and restricts the flow of oxygen-rich blood to the heart. Plaque rupture or tears. In many cases, the plaque ruptures. When it does, the blood surrounding the rupture forms a clot. The clot can block the blood vessel completely, cutting off oxygen and blood flow to the heart muscle. The heart muscle suffers. With the blood supply cut off, the heart muscle begins to die. This process typically begins within 15 minutes of the blood flow being interrupted. Damage to the heart. If the blockage is not cleared quickly, the heart muscle will start to deteriorate. The severity of the damage depends on the location and extent of the blockage. The longer the heart is deprived of oxygen, the more extensive the damage can be. The after effects. If a large part of the heart muscle dies, it can lead to heart failure or other serious complications, including arrhythmias, irregular heartbeats, shock, or even death. Symptoms of a heart attack. Heart attack symptoms can vary from person to person, but common signs include chest pain. The most recognized symptom is chest discomfort or pain. It may feel like pressure, tightness, fullness, or a squeezing sensation. Some people describe it as a heavy weight sitting on their chest. This discomfort often radiates to the left arm, neck, jaw, back, or stomach. Shortness of breath. Many people experience difficulty breathing or shortness of breath during a heart attack. This occurs because the heart is struggling to pump blood effectively, which affects the lungs' ability to oxygenate the body. Nausea or lightheadedness. Some individuals feel nauseous, dizzy, or even faint, especially if the heart attack is affecting the heart's ability to pump blood to the brain and other organs. Sweating and cold. Sweat, profuse sweating, often cold, and clammy, is a common symptom, particularly among women. Fatigue or weakness. Unusual fatigue, feeling weak or lightheaded, can be a symptom, particularly in women. It's important to note that not everyone experiences the typical Hollywood heart attack symptoms of extreme chest pain. Some people, especially women, may have more subtle symptoms, including discomfort in the back, shoulders, or stomach. When to seek help. If you experience any of the symptoms mentioned above, it's crucial to seek medical help immediately. Time is of the essence when it comes to heart attacks. Quick intervention can save heart muscle and increase survival chances. If you are with someone experiencing these symptoms, call emergency services right away. The earlier treatment is administered, the better the chances for a full recovery. Treatment for a heart attack. When a person arrives at the hospital, doctors will quickly assess the situation to determine the extent of the heart attack. There are a few key treatments that are used to save lives and restore blood flow to the heart. Aspirin. One of the first treatments is aspirin, which helps to thin the blood and reduce clotting, improving blood flow. Thrombolytics, clot-busting drugs. If the blockage is caused by a blood clot, doctors may administer medications to dissolve the clot. These drugs work by breaking up the clot and restoring blood flow to the heart. Angioplasty. For some patients, doctors will perform a procedure called angioplasty. This involves inserting a catheter into the blocked artery, inflating a balloon to open the artery, and sometimes placing a stent to keep the artery open. Coronary artery bypass grafting, CABG. In more severe cases, where the artery is blocked in multiple places or the blockage is too large to treat with angioplasty, doctors may recommend bypass surgery. In this procedure, a surgeon takes blood vessels from another part of the body and creates a bypass around the blocked arteries. Medications. After the heart attack, doctors will often prescribe medications to help the heart recover. These may include beta blockers, ACE inhibitors, or blood thinners, depending on the individual's condition, preventing a heart attack. The good news is that many heart attacks can be prevented by making healthy lifestyle choices. Here are a few tips to reduce your risk. Maintain a healthy diet. Focus on a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit saturated fats, trans fats, and cholesterol. Exercise regularly. Aim for at least 150 minutes of moderate intensity exercise per week. Regular physical activity helps improve heart health, control weight, and lower blood pressure. Quit smoking. Smoking is a major risk factor for heart disease. Quitting smoking improves blood circulation and reduces your risk of a heart attack. Control blood pressure and cholesterol. High blood pressure and high cholesterol are significant risk factors for heart attacks. Regular checkups and medication, if necessary, can help control these conditions. Manage stress. Chronic stress can harm your heart. Practice relaxation techniques such as deep breathing, yoga, or meditation. Regular checkups. Make sure to visit your doctor regularly to monitor your heart health and any underlying conditions such as diabetes or high blood pressure. Conclusion. Understanding heart attacks, what they are, how they happen, and how to prevent them can make all the difference when it comes to saving lives. By being aware of the symptoms, acting quickly, and making healthier choices, we can reduce the burden of heart disease and improve our quality of life. Remember, your heart is your lifeline. Protect it, nurture it, and it will carry you through for many years to come.